All right, welcome to our first module, all about body temperature assessment. Now, this is one of the most fundamental skills you'll master as a CNA, and I want you to remember you're not just getting a number, you're actually gathering super critical information that the whole healthcare team relies on. So, let's dive right in.
Okay, so here's our game plan for today. First, we'll talk about why temperature even matters. Then, we'll get into the numbers, what's normal, high, and low. After that, we'll cover the 5 different ways to take a temperature, how to pick the right one for the right situation, and we'll wrap up with your professional responsibility. Pretty straightforward, right?
All right, let's get started with section 1, why this is all so important. I mean, really, why do we care so much about taking a temperature? Because, believe me, it is so much more than just a routine task. Think of it like a little window into what's happening inside a patient's body. So, what is body temperature really? Well, you can think of it as this incredible balancing act. Your body is always making heat, from all its internal processes, and at the same time, it's losing heat to the outside world. And the part of your brain in charge, the hypothalamus, it acts just like the thermostat in your house, constantly making tiny adjustments to keep your body in that perfect, sweet spot range where all your cells can work their best. So, taking a temperature, it's a critical vital sign for 3 main reasons. First, and this is the big one, it helps you spot trouble. You can detect a fever, which could mean an infection is brewing, or you can catch hypothermia, which is a really dangerous drop in temperature. Second, it lets the team know if a treatment is actually working. And third, it helps you establish a baseline for that specific person. Because, and this is really important, normal is not a one-size-fits-all number. Okay, let's move on to section 2. It's time to talk numbers. You've absolutely got to know the ranges. What's normal, what's a fever, and what's too low. This is non-negotiable stuff for keeping your patients safe. We all grew up hearing that 98.6 is the normal temperature, right? Well, I want you to kind of throw that idea out the window. It's just an average. The reality is a normal temperature is actually a range, and that range changes depending on the person's age and, really importantly, where you take the temperature. That's why you always have to document the site you used. It's just as important as the number itself. So let's define the abnormal. What are the magic numbers you need to look out for? For a fever, also called pyrexia, we're talking about anything 100.4 degrees Fahrenheit or higher. On the flip side, hypothermia is when the temperature drops dangerously low, below 96.8 degrees. If you see either of these numbers, that's your signal. That's a red flag that needs immediate attention. All right, time for section 3, the really hands-on part. We're going to master the how-to. We'll walk through step by step the 5 main ways you'll be taking temperatures as a CNA. Okay, before you even think about grabbing a thermometer, these 5 steps have to happen every single time. First, hand hygiene. Wash them or gel them. Second, introduce yourself and double-check you have the right patient. Third, just quickly explain what you're going to do. It really helps build trust. Fourth, provide privacy. Pull that curtain. And fifth, put on gloves if your facility's policy requires it. First up, the oral method. This one's super common. But before you start, you've got to ask, have you had anything hot or cold to drink, or have you smoked in the last 15 minutes? If they say yes, you have to wait. Okay, so you'll pop on a clean probe cover, and then the real key is to place the tip way back under the tongue in that little pocket on the side. That's the sublingual pocket, and it gives a good, accurate reading. Then just ask them to close their lips around it and hold still till you hear the beep. Next, we have the axillary, or underarm, method. This one is probably the safest, which is why you see it used a lot with newborns. Now, the single most important thing here, make sure the armpit is completely dry. Any sweat will give you a reading that's way too low. So you'll place the probe right in the center of the armpit, have them bring their arm down across their chest and hold it snugly. Just remember, this method is generally considered the least accurate. Okay, method number 3, tympanic, or in the ear. This one is super fast and actually really accurate, but there's a trick to it. To get an accurate reading, you have to straighten out the ear canal. For an adult, you'll gently pull the top of the ear up and back. That little move creates a straight shot for the sensor to the eardrum. Then you just insert it till it seals, press the button, and you're done in a second. All right, let's talk about the temporal artery method. That's the one you slide across the forehead. These are awesome. They're quick, and you can use them on anyone. The big pitfall here is sweat. If the forehead is sweaty, it'll cool the skin, and your reading will be wrong. So make sure it's dry. Then you just place the scanner flat on the middle of the forehead, press and hold the scan button, and just glide it smoothly across to their hairline. Easy as that.
Okay, last one, the rectal method. Now, let's be clear. This is the most accurate method, but it also comes with a huge safety warning. You cannot use this method on patients with certain cardiac conditions. Why? Because it can stimulate something called the vagus nerve, which can actually cause their heart rate to drop dangerously. For the procedure, you'll use the thermometer with the red tip, lubricate it, gently insert it about 1 to 1.5 inches for an adult, and, this is critical, you hold onto that probe the entire time.
So now you know the 5 ways to do it, but the real skill is knowing which one to choose, right? That's what Section 4 is all about, using your best clinical judgment to pick the right tool for the job. Let's look at this chart. Think of it as your cheat sheet. For a little baby under 6 months, an underarm temp is fine for a quick screen. But if you need a truly accurate number, rectal is the gold standard. Got a confused patient? You are not putting a thermometer in their mouth. That's a biting risk. Go for the ear or forehead instead. Someone just had oral surgery? Obviously, you're staying away from the mouth. And that cardiac patient we just talked about? Absolutely no rectal temp. Stick with oral or tympanic to avoid that vagal nerve risk. Okay, we're on to our final section, your professional responsibility. Look, your job isn't over when the thermometer beeps. In fact, what you do after you get the number is just as important for your patient's safety. So picture this. You take a temp, and the number that pops up is not normal. Maybe it's 101.5, maybe it's 96.2. What's your next move? This is where you, the CNA, become a critical line of defense for your patient. Okay, here's your 4-step action plan. Step 1, if the number seems weird, take it again. Step 2, look at your patient. How are they doing? Make sure they're safe and comfortable. Step 3, and this is the big one, tell the nurse. Immediately. Go find the nurse right away. And finally, step 4, document it. If you don't write it down, it didn't happen. And what does good documentation look like? It's something like this. You got the time, 0830, the temperature, 101.5 degrees Fahrenheit, and you specify how you took it. Tympanic, right ear. You also add what the patient told you, patient reports headache, and crucially, you close the loop. RN Smith notified. See how that paints a complete picture? So I want you to leave this training with this one thought. Never, ever think of taking a temperature as just another task. It's not. Your accuracy is what gives the whole team the right data to protect your patient. Your vigilance, that can literally save a life. That is the incredible power and responsibility you have as a CNA.